We had a patient that was an organ donor, and we were able to donate some of her organs to other patients in need. And a month later, we got a letter from the family telling us how much they appreciated us and letting us know how many lives we were able to change with that organ donation. When I come in the morning, the first thing I do is I usually go to the locker room. I get changed out into the scrubs that the hospital issues us. I spend the day in a very sterile environment, so we don't like germs in the operating room. During the surgery, I assist the surgeon. I will pass them instruments, I will cut suture, I will retract, hold anything they might need. If I need to hold maybe an organ, honestly. If I need to hold something back, if I need to prep a site. Basically anything that the surgeon needs support in, I'm there for. The OR is made up of a team. You have your nurses, your scrub techs, your CRNAs, and your surgeon. Each one of us plays a vital role in making sure the patient has the support they need. For example, the surgeon can't do the surgeon's job without he has to know that I have everything he needs or she needs in order to finish the job. So that's one of the biggest things about being a surgical technologist is you have to be prepared for anything that might happen during surgery. I dabbled in the law enforcement career for a while. I enjoy helping people. Unfortunately, law enforcement didn't allow me to help people the way I wanted to. So I knew I wanted to do something in the medical field, and I knew that I wanted to be in surgery. So surgical technology was the path that I could take to get in the operating room without having to go to 12 years of medical school. After I graduated, they have now changed it, so it's a 2-year degree. So you would have to get an associate's degree for this career now. It is required of me in order to keep my certification that I complete so many continuing education classes within a certain amount of time. So I'm constantly learning new skills. Yes, communication skills is probably one of the biggest ones of all. You have to know how to communicate with your teammates, your doctors, and your patients in a way that everybody knows what's going on. I would say have thick skin, because when you're in the operating room, emotions can run very high depending on what kind of surgery you're doing. And so you can't be emotional when you're doing the surgery. You have to think about the patient and the job that you're trying to do. I would say if you have a hospital near you, I would say call the hospital, see if you can volunteer, go shadow, go see what it's about, and see if you like it. I would recommend any science, anatomy, physiology, anything that can help you understand the human body better. The most rewarding part of my job is knowing that someone gets to live another day because I was there to support our surgeons.